I think one thing that happened to you in your research that really it's almost like the moment where like Galileo when he disproved something from Aristotle. The anatomy books showed the grain of the interspinous ligaments going one particular way, and people had copied those for centuries going the wrong way. But you discovered the grain was the opposite. Is that true?
Yes, it was so interesting. I went to the cadaver lab my first time, examined the interspinous ligaments, which, let me just unplug here and I'm going to get a model. Can you still hear me, Bill?
Perfectly.
Okay, so the interspinous ligaments, which check forward motion, have an angle that run this way, so that as the spine flexes forward and those ligaments strain, they push the superior vertebra forward. Well, the anatomy books show them the opposite, that when you flex the spine, they pull the superior vertebra back, as does, say, the muscles of longissimus and iliocostalis. Well, I thought I had a mutant cadaver, so I went to the next cadaver, but of course it was exactly the same. And so all of a sudden, I started to realize how important posture was to shear load and why certain people with laxity in a shear mode, if you were to test that, were often provoked by full flexion and engagement of those ligaments. Well, I traced that back to the 1800s in the English-speaking anatomical literature, and there it was. Now, interestingly enough, the German-speaking anatomical literature always had it correct. But Gray's Anatomy, Grant's Atlas, and then there was an anatomist in Ireland named Dave Halings, and he pointed this out, and he traced back to an anatomical artist in the 1800s. And now we know that every anatomical artist, including people like Frank Netter, the famous clinical series, only copied the previous artists. They didn't go back to the original anatomy, which I found so interesting.